Hello?
Hello.
Hi, you can hear me, obviously?
Yes, and this is?
Jill.
Oh, hi, Jill. I'm
Uh,
looking to see where the panelists are. I don't see your name on here.
Jill Frankel. I'm on
Yeah,
the
oh,
Edu.
no, I know who you are, but I'm looking at the attendees. And okay, wait a minute, staff. Got it.
Am I in
Okay.
there? Okay.
Yep, you're there.
Okay, great.
I've put you and Nevada on last.
Okay.
And so what we're going to do is we're going to go through this. Just, I don't know if we're going to have time for questions, but we'll have people submit questions and then I'll send it out to the panelists and you guys can answer.
Okay. Okay, great. Thank you.
Mhm.
And then I'm assuming I'm going to be muted until I come on, or am I going to mute
No,
her? What?
you need to mute. You need to mute yourself.
Okay. All right. So, all right. So can I do that at this point?
Sure.
Okay, great. Thanks.
Hi, everyone. For folks who have already joined us, we will start promptly at 1 o'clock. We're waiting for the speakers to come on board. Please know that if you are a social worker or you need a certificate of attendance, in the question part of, I don't know what you guys see, but I have a little question box. Please put your name, and if you know your license number, put that, but indicate that you need a social work license and or a certificate of attendance. So you need to, that's going to be your sign in, and then at the very end, you're going to be doing the same thing, saying just this is so-and-so signing out. Okay, that's how we're going to know that you were there the whole time, and if you don't, I'm not going to be able to give you that certificate. Thank you.
Hello?
Hello, Sarah, you're on. You're
Hi, this is Debbie Picker. I'm one of the panelists.
great. You're good.
Okay.
Good enough. We're just waiting for a couple more panelists. Thank you.
Sure.
Sounds good. If somebody, whoever is typing, could you please mute yourself? Thank you. Okay, we have, most of our speakers are here. We're just going to go ahead and get started because we have a very, very, very tight program. And so, first of all, I want to welcome you. We are so excited to be able to offer this. I am not Shannon Moniak. I'm Kathy Foley with Services for Independent Living. And we are very fortunate to be able to offer this program with the support of the Western Reserve Area Agency on Aging as a co-sponsor, and a special thanks to the Ohio Developmental Disabilities Council for their support and vision. They have been a phenomenal partner to work with. To let you know what's going to happen today, we're going to try to keep this at an hour. We will be offering 1 hour for social work CEUs. We are not able to offer the CRC credits. with OOD as we had originally hoped. If you need either a social work certificate or a certificate of attendance, take a look at the question area and put your name and what type of certificate that you're going to need. And if you could do that now, and then when you sign out, put your name and say signing out. You are going to be muted, and just know that the slides are going to be available at our website, which is www.sil-oh.org. They will be in a PDF format. And so with that, the other thing that I wanted to say, because we have such a tight schedule, if we do not, if we're not able to, answer any questions, we do have your questions. Put them in the question, write them down in the question part of your screen, and we will send the questions to all of the speakers. So they will be answered that way. So again, I want to thank you for coming to our session, which is promising transportation options for older adults and individuals with disabilities. And because we all know that this is a huge issue with the individuals that we work with, both in urban and rural areas. And so we have some really cool, promising practices at the table with us today. So I am just going to get off here, and I'm going to turn it right over to Sarah White. And Sarah, what I'm going to do is, and this is for all the speakers, tell me when you need me to advance the slide, and then I will tell you when your time is almost up. So take it away, Sarah White.
Okay, thanks everyone. Just to get started, my name is Sarah White. I'm a mobility manager with NOACA in downtown Cleveland. We are the Metropolitan Planning Organization for Cuyahoga, Geauga, Lake Lorraine, and Medina counties. And we work specifically on transportation, air, and water quality issues for our region. Kathy, you can go to the next slide.
Oh, it's not wanting to do it. That's right, there we go.
Okay, you can go to the next one. So the first question that people often have is, what is mobility management? And in a lot of realms in the news, mobility is a big buzzword, and it can mean lots of different things. But mobility management as a profession is looking at strategic ways to coordinate transportation services. We often focus specifically on seniors, individuals with disabilities, people with low incomes, because oftentimes people can have many of these concerns when trying to find transportation, and then also people with specialized medical needs. So it could be a permanent medical need, it could be a temporary medical need, but what we're working towards is less service duplication. So filling those gaps, making sure that we're coordinating and doing more with less resources, because everybody knows one of the biggest struggles is funding, and it can be so difficult. But we're really also working towards better access to vital services, because we all know that mobility and getting where you need to go and reaching the doctor's office, all of those things equal a better quality of life for everybody. Next slide. Okay, so I'm just going to go through a little bit of mobility resources. As a mobility manager, I find myself being a convener, and I like to share information with everyone. I don't get to do a lot of on-the-ground work like a lot of our awesome transportation providers do, but I try to bring people together and share what I can. So next slide. During COVID and in normal times as well, I found that the National Center for Mobility Management has been a great resource. They specifically have a COVID-19 resource center, so they have links to information from the CDC, from the Federal Transit Administration, APTA, and the Community Transportation Association of America. So it's got best practices, guidance, And sometimes it's split up even by state, so you can see what's required in your state. They also have a really insightful blog. So there's information about being a mobility manager during coronavirus. And there's a lot of focus on flexibility, creativity, and empathy to serve the community. And that is just so important in day to day. And so it translates well for mobility managers during some difficult times. So, for example, instead of transporting individuals, vehicles can be used for groceries or medications or to get those essential supplies to vulnerable individuals. And they also have a really interesting survey available on their website where you could go on, explain how your service has been impacted by COVID, and then they will take all this information and put it together and have a really interesting report. Next slide. Speaking on something that's a little closer to home, I am one of the co-conveners of the Northeast Ohio Mobility Coalition. We convened in October 2014, NOACA and the American Cancer Society together, put the group together. We've been going for the last 6 years, and we have quarterly meetings where we really are looking to bring everyone together to discuss concerns, promising practices, and just to share information. So most of our region's public transit providers have been involved, private transportation providers, and then also social service agencies. Next slide. And to go along with our local coalition, we started quarterly newsletters in spring 2017. So instead of sending out emails all the time with new info or funding opportunities, which I know a lot of people really need to focus on, we started mobility news. So every quarter we send it out with an agency partner spotlight, policies that would be important to providers, again, funding opportunities, and then our training and meeting schedule. Our summer 2020 issue will be coming out later this week. So if you're not on the email list for our mobility news and you're interested, I can make my email available. You could just email me and I will add you. And then next slide.
Hang on. It's playing games. There we go.
And then dialing it down even a little bit more, what the agency I work for, NOACA, what we have available, resources available to everyone in our 5 counties. So one is the Enhanced Mobility for Seniors and Individuals with Disabilities, which is also known as Section 5310. It is a federal transit agency program, and it provides federal dollars for providing transportation for seniors and individuals with disabilities. So my agency, NOACA, we're the designated recipient from the federal government in our Cleveland urbanized area. So for example, this funding cycle, we have $1.7 million available to transit agencies, nonprofits, social service agencies, and other transportation providers. Right now, our priority is funding vehicles. So we're funding replacement vehicles and sometimes also vehicles for service expansion. Our application for this new round, it actually was just made available on our website this week. So we have this new funding round coming up, and we will also be hosting a virtual applicant workshop on July 9th from 1 to 2 p.m. So our website is noaca, noaca.org, and you can access all information about 5310, our application, and then more info about our workshop. Next slide. And then lastly, part of our work is also, again, education and sharing. So we have started a Lunch and Learn webinar series, and we will be, our first one actually is planning for age-friendly communities. It is set to take place on Thursday, July 16th from noon to 1. We're looking to share information about how communities can really help older people age in place, and how transportation is such a vital part of that. So our speakers will be Janet Seigel from STC, Mary McNamara from the City of Cleveland, she's the Director of Aging, and then Fatima Perkins from Western Reserve Area Agency on Aging. The link is in the presentation, but really the easiest way to get there would be to go to NOACA's website, and then you can sign up for this virtual opportunity. And next slide, and I think that's it. Thanks, everyone. And again, I will put my email address in the chat box if anyone would like to get our mobility newsletter. And I will also have all of the links I shared in the mobility newsletter coming out later this week.
Okay, Sarah, I don't think that the people can see the chat box, so put it in the question area.
Okay.
Only we can. Okay, so now I thank you so much. Now I'd like to turn it over to Deborah Picker, and with a really cool program. And so, Deborah, take it away.
Well, hi, I'm so excited to be here, and I apologize for my slides. I had this really cool template in the back, and obviously it did not transfer. But FAIRCLE is an acronym for Find a Ride Easily, and we started in 2017. Next slide. So this was our mission because I was a former interventionist and in the schools, and I worked with kids with special needs, and I saw that so many of them would graduate from my program, but because of their disability or because of their lack of financial means, they would graduate and then they would sit home. And as we all know right now, isolation is so detrimental to mental health. And these individuals had such abilities, but they weren't able to access community work or community activities because of their financial needs and their cognitive challenges. Next slide. So these are facts that I'm sure that you all know, and this was the basis of the development of FAIRCLE. I'm the founder, but I'm also the executive director. So I'm not going to read this to you, but I think this, the fact that people with disabilities are 5 times more likely to be homebound than people without disabilities, obviously that was before coronavirus. So this is a different statistic today. Next slide. So we are a supplemental service. What you're seeing on the page are my 2 children, 2 of my children. They both are adults with Down syndrome. And so aside from the kids that I taught and followed, they were the other motivating factor. I talked to other parents as well. If we wanted to keep our kids engaged, then we had to be always providing the transportation for them. And parents work and parents have other obligations. So we've developed this as a supplemental service to assist parents in transporting their kids and their adult children and engaging them. But the other issue is that a lot of the Medicaid provided services, non-medical transportation, were limited to 2 trips a day for work. And so things that our adults with disabilities wanted to do, they weren't able to attend using that non-medical transportation because they used up those rides going to work or day program. This is sort of like an Uber. I have people drive their own cars, but you can share transportation with other riders to go to the same place, and that will impact your price. The Uber part of it is that it's individual independent contractors providing the rides. However, you need to schedule rides a week in advance if possible. The rides are also very customized, which is unlike Uber. Our drivers are trained and vetted, and you'll see more about that later. And they are customized to the needs of the people that are riding. Next. So if you're a driver, these are the requirements that you need to, I don't know why that word says disease, but okay. I think things got messed up on the slide. People that we are addressing, the population that takes advantage of this service are people that have intellectual or developmental disabilities, or they're seniors, or they have mental health disorders, and the cognitive issues are due to age or disease. I see that now. For drivers, and I really apologize for the confusion, they drive their own car, they get background checked, they have to deliver a motor vehicle report to me, they have to have references, they have to have training. Next. And these are some of the places that we go to. So these are some of the activities outside of work that people have taken Berkeley to go to. We address primarily the people on the east side. We had some west side folks, but it was very difficult because we had most of our drivers are located on the east side of Cleveland. We also drive into Lake County and into Geauga County when needed. So one of my riders goes to Lakeland College, and another one has a job activity out in Chesterland. So the drivers originate in the eastern suburbs, and then they drive from there. Next slide. So riders connect through this process. They register online. It's mostly an online process, except for the fact that the riders are interviewed by me to determine what their needs are and what their levels are. What are their communication levels? If they have autism, what are their sensory needs? So they do have an interview before they are matched and enrolled in the program to determine what their needs are so that we match them with an appropriate driver. Next. So this is how we're different than some of the programs that exist through the Medicaid waivers. We are personalized, which I explained already, and we're customized. The riders need to fill out a questionnaire. The drivers drive around with their medical form, because if, God forbid, there was an accident, our riders may not be capable of conveying any vital information. So their important information is transferred to only their driver to maintain confidentiality, and the drivers drive around with that electronically on their smartphone. We have flexible days and hours. A lot of our transportation takes place on Sundays or after that 5 o'clock time period. People that have varying needs, like I need to work this schedule this week, but a different schedule next week, we're able to meet those needs as well. There is a tremendous amount of communication and relationships developed between the drivers and the riders and the rider families. We accept only the self waivers and e-payments. The riders are not responsible for carrying money in any way. And we have scholarships available. We're a nonprofit, and we realize the low income of our riders, and it can get expensive. So we try to be very generous with scholarships for these rides. Next. And this is what a lot of the families are saying. You know, they're very happy with the service. I think it becomes kind of an intimate, relational process for the families, so they feel very confident because they have relationships with the drivers. Their loved one may not have the same driver every time, but they will have one of a handful of drivers. So they can look up on our website and see the picture of the person that's picking up their loved one. They could see some of their bio so that they feel they know who is with their family member. Next. So this was my daughter Erin, and this was her friend, and this was their very first ride using Fairclee services when they opened. So I had to put that in because I thought that picture was awesome. And there's my information. If you need more information, you are welcome to email me or go on the website for sure and check us out.
Deborah, thank you so much. And as you guys see, we're giving you a flavor of some of the different types of transportation programs that are around. Please contact these folks if you want more information. So now I'm going outside of our region, and I'd like to invite Carolyn Connolly, who's the Transportation Division Director for what we call HAPCAP. So Carolyn?
Hi, thanks so much for having me today. I'm excited to be here and not only share our story, but also learn more about what other folks are doing across the state. It's always good to hear other thoughts and ideas, and so thank you for having me. Just a brief overview of who we are. Again, my name is Carolyn Conley. I am the Transportation Division Director at HAPCAP. We serve a 3-county region, Hocking, Athens, and Perry County here in Southeast Ohio. We have a total of 5 divisions. In the sake of time, I won't go over most of that. Here's our 4 other divisions, but our primary is the one we're talking about today is our Transportation Division. Next slide, please.
Oh, doesn't want to go. Bear with me. Okay.
So HAPCAP has 5 transportation programs. We also have a mobility management program. We also run Athens On-Demand Transit, which we will talk about in more detail here today. We also run Athens Public Transit, which is primarily a fixed route service within the city of Athens and a few outlying communities. We operate GoBus, which is a rural intercity bus service. It acts a lot like a Greyhound service, but it connects rural communities with urban centers. And we also run Logan Public Transit, which is a door-to-door transportation services in Hocking County. Next slide. So just to give you an idea of where the region we're talking about, Athens On-Demand Transit serves the entire county of Athens here in Southeast Ohio. We face some unique challenges, maybe a little bit different than some of you folks in the more urban areas. Athens County is very rural, it's very hilly, and boy, does it have a lot of roads. And houses are kind of sprinkled out through the whole region. So it is difficult for many folks with disabilities, folks who are older, as well as low-income individuals to get where they need to go. They often feel isolated, even though they may only be a few miles from town. Just the roads and their lack of transportation really provides barriers. And it was because of this we started Athens On-Demand Transit. Next slide.
I think it might be breaking up.
Oh, is this any better at all? Can you guys hear me? Uh-oh.
Yeah, I can hear you fine.
Okay. Did you want me to try to repeat any of that, or did you guys mostly get that?
I think we got it. It might be the presenter's connection.
Okay. Next slide, if possible. Seems like we're having some technical difficulties, huh? I can continue to talk until we can try to figure it out. Athens On-Demand Transit started in 2012. It was started with 1 van, and it was a pilot project. It was really started based off of this need that we saw in our area to helping these folks in isolated areas. We started with service just Monday through Fridays, and we focused on individuals with disabilities and senior citizens. We had 4 part-time drivers, and so it was very small scale, but we were really excited to get it off the ground because it was truly meeting a need in our region that hadn't been met. And just to give you some idea of scale, in 2013, Athens On Demand Transit provided 5,636 trips and traveled a little over 100,000 miles. So we consider that a true success. Our first full year in service, excuse me, we were really, helping folks get, excuse me, where they needed to be. But by comparison, Athens On Demand Transit has expanded just this year to beyond individuals with disabilities and senior citizens. While we're still serving those folks, we are now open to the general public, so anyone can call and request our services, and we will come either to their residence or wherever they may be and take them where they need to go. We now offer Saturday service, and just to give some idea of scale, we went from our 4 part-time drivers, we now have 7 part-time drivers and 2 full-time drivers. Just last year in 2019, we provided more than 12,000 trips and traveled nearly 175,000 miles. As I was kind of saying before, the need for the service started out by identifying these isolated individuals within our region. We wanted it to be affordable and accessible for all. So all of our fares are $2 one way. We are limited to the county, within the county, but it doesn't matter wherever within the county those individuals are traveling. The cost is $2 one way. For seniors and individuals with disability, when they apply for that reduced rate, we actually offer a $1 one-way trip. So it's really affordable for folks and trying to help them affordably get to where they need to go. Another thing that we provide our riders is we try to ensure that they have all the information they need. So every passenger gets a card as they deboard our vehicle, so that they know who to contact if something happens, that they maybe are confused about when time they're supposed to be picked up, or something has changed of when they need to be picked up. They can give us a call and contact us directly, and we will work with them to adjust their schedule. I had a little slide with some fun statistics on it, but without being able to see that, we won't go into that. But that's pretty much my presentation. We are excited for this year with our expansion. We've had many challenges this year, with COVID and everything, but we're really filling a niche within our community, and we've been able to continue service despite the challenges that we faced this year.
Folks, I'm not sure why we are losing our slides, we were going to be working on that. Thank you very much for your patience. Remember, the slides will be available on our website, but again, we're going to try working on that. And Carolyn, thank you so much. Next, I would like to bring on Michael Radcliffe with the Cuyahoga County Board of Developmental Disabilities. And Michael, go ahead. Okay, Michael, you are unmuted. Okay. I love when technology works out. Stop showing shades. Show screen. Okay. Michael, well, we're trying to work this out. Please email me, and then I am going to take it to the next group, which is, wait, show screen. This drives me nuts. Bear with me, please. I'm so sorry about this. Jill, if you in Nevada would like to take it over, so you can see the slides now? Okay, so we've got that together.
Thank you, Kathy.
Yes. Sorry about
Uh,
this.
It's never fun when the technology doesn't work. Are you ready for me?
Go ahead.
I think Kathy's breaking up. So I'm going to go ahead and get started. I wanted to thank you for including me this morning to discuss our transportation dilemma and the solutions we found, which was Uber Health. I also want to thank Nevada Griffin, who's on the call with me. He's up particularly early on Pacific Coast time, so I really appreciate you joining us. I thought he would add value. We are the City of Solon's Office on Aging, and we're known as the Solon Senior Center. We're a city of approximately 24,000, and about 6,000 of those people are older adults. We provide both community supportive living programs like transportation, as well as adult recreation. Next slide. You may be stuck with mine as well.
Oh, yes. I am so sorry. It's showing fine on my computer.
Okay. So if you can catch up to me, go ahead. Do you want me to wait or you want me to go? I'll just go ahead.
Just keep saying
going.
next slide and keep talking, and we'll just make it work. And again, I apologize. So it looks like there's a time delay.
Okay, there we go. There's our next slide. We provide transportations both within the City of Solon and outside the City of Solon. Our in-town services are provided by us in-house, and our out-of-town services are subcontracted for rides in Cuyahoga and borders of surrounding counties. Our transportation is provided for medical, errands, and socializations, and close to 90% of our out-of-town rides are for medical reasons. Next slide. At the end of 2018, we found ourselves with a transportation dilemma. As you can see from the slide, we were experiencing increased riderships, up 36.5% in 2018 from 2017. You'll also notice an additional spike at the end of 2019, and then a significant drop due to the outbreak of COVID-19. In 2018, we were due for a contract renewal with our out-of-town provider, and recontracting was going to mean a significant increase in our per cost trips. So we needed to go out to bid, and were able to remain with our present provider. But we knew that we needed to explore changes for 2019. Questions were, should we reduce service, limit schedules, decrease our transportation area? Should we group riders? Should we ask for a higher rider contribution? Or could we increase our spending to cover our needs? Next slide. Our final option was to research other options. And if we get to that slide, you'll see more, but I can certainly talk about it.
We're losing network connections is what it's telling us.
Oh, okay. We found Uber Health and researched its service and safety practices. For approximately a month, some people in the department sat with cell phones on their desks and almost hourly checked for availability, response time, and estimates for fares to our high demand locations. Our findings from that indicated that it was worthwhile to trial the service. So in April of 2019, we selected a small group of our highest utilizers of our out-of-town services. We selected people who did not utilize a wheelchair, and they needed to have a cell phone that they could receive text messages on. There we go. The cell phone, the text messaging was required. We could reserve the rides by phone, but we could schedule them on the Uber dashboard, but the rider needed to be able to see when their pickup would be coming. We brought our riders in for a meeting to discuss the trial and the benefits for them. And for them, they would have no contribution during the trial and no limitation in rides. And for the city, of course, the benefit was cost savings. The trial helped us develop the service framework. Some modifications needed to be made during the trial. We quickly learned that in order to successfully utilize the service, riders needed to have minimal or no limitations in mobility and cognition. We also learned that if they could utilize the service, riders could easily utilize and understand on-demand redeemable rides. By August, we determined that the benefits were significant enough that we should formally utilize Uber Health as an additional vendor for our out-of-town rides. And what we found is a cost savings of a little bit greater than $3,500 for the same number of rides, and our average ride cost was $19.48. We found that we could maintain cost savings while allowing people to travel further. Utilization of the Uber Health dashboard allowed us to further ensure rider safety by increasing rider visibility during their rides. We could see where they were and when they were being picked up and dropped off. Riders truly enjoyed the service. They expressed feelings of greater independence and pride in using transportation that the general population used. Proof of this occurred during the trial when their ridership increased week to week. I've been told by our present ride provider that they received a benefit as well. They were experiencing some staffing shortages, and increased ridership above our contracted levels would have been difficult for them. So what we found was utilizing a combination of providers, Uber Health and STC for all riders, has allowed us to contain costs and maintain the same level of service for all of our older adults. So at this point, I'm going to turn it over to Nevada, who can better explain Uber Health and its services. And the last slide, if it comes up, is my contact information, which you'll get when you get the slides. Thanks, Nevada. Turning it over to you.
Of course. Thanks, Jill. Thanks, everyone. Happy to be here. So my name is Nevada Griffin. I lead our business development strategic partnerships for Uber Health. So as Jill mentioned, very happy to share a little bit about Uber Health for those of you who are not familiar with the platform, how it works, and its genesis. Next slide, please. Actually, you can skip 2 ahead. So I want to talk to you a little bit about the origins of Uber Health. Uber Health is actually, many people, when you talk about Uber Health or Uber in general, they kind of associate it with, taking a millennial to the bar on a Friday night and aren't as familiar with some of the broader work that we do across a variety of different areas. And the origins of Uber Health actually reach back to 2014 when we started a number of different experiments and pilots in cities across the US focused on targeted health outreach. So that ranged from flu shots, which were the initial experiment in Boston, to a number of other things that you see here, including diabetes and testing and cancer screenings, among others. These were all, I think, really interesting initiatives, and we learned a lot about the technology, the power of the channels, and the platforms that we had. And we're proud about these projects, but we knew we could be doing quite a bit more on an ongoing basis. So while each of these were kind of targeted one-off experiments, Uber Health today is now an ongoing program. Next slide. So I'm just going to keep going. I think it's important when we talk about Uber Health to highlight a little bit of the how and why. And we've heard a lot today of I think, some really compelling stories about why each of the individuals who have presented do what they do, and the impact that they're having. And I think a lot of that resonates true for Uber Health as well. I think since our early days, we've continued to evolve the product, and really have honed in on focusing on offering help to serve those who have the greatest needs when it comes to transportation and mobility. And part of the reason we're here today, is based on Solano's own experience and Jill and team's own experience. So anecdotally, many of you will know this already, but I do want to highlight a recent study that was conducted by researchers at USC, and it's ongoing research, but it's quite a large trial. And what they've found is by providing, much as we've just heard from Jill, providing services to access to rideshare services for senior citizens and elderly communities, the quality of life has actually been reportedly improved by 90% and above, and across the board. And so I think just the mere fact that this is providing access to, a convenient on-demand access to a wide variety of services, is just, as we all know, can be life-changing for a lot of folks. So let me tell you a little bit about the platform. Next slide, please. So Uber Health is part of what we call Uber for Business, and that's Uber's B2B entity, and its sole focus is on removing transportation as a barrier to care. So what it is, it's a centralized dispatch platform through which organizations can schedule or book on-demand non-emergency transportation for patients traveling to and from care locations. The platform was designed such that patients or the end users actually do not need access to a smartphone. So as Jill was mentioning, it helps to orchestrate aspects of the ride, but it's not a requirement by any means. And the reason for that is obviously not everyone who we're serving has access to smartphones, and so we didn't want them to be excluded and have designed the product accordingly. I think the last thing to note is that given that we do operate in the health space, we take patient data and privacy very seriously, and Uber Health is actually its own separate LLC, and housed the product and the platform and the data that it uses are housed in a secure and protected platform, and our team have undertaken HIPAA certifications across the board. Go ahead and skip 2 slides ahead, please. So how does it work? So really, I'm going to just walk you through kind of 3 steps. Initially, a healthcare associate or the end user who needs the ride will call their team who's coordinating it. So as an example, you would interact and coordinate through Jill's organization. Then someone on Jill's team would actually schedule and request that ride. You can do it on demand or up to 30 days in advance, and make it immediately available for that individual if needed. The next step, the passenger is contacted by text or a phone call with their trip details. If they receive a phone call to a landline, they will be told over the phone in an automated way, what vehicle to expect, some of the identifying characteristics of that vehicle, and what time to expect it when the driver is on their way to pick them up. And then lastly, the passenger will be picked up and dropped off, and usually this is the same experience that you would have through Uber's standard network. So, from the time of order to the time of arrival can be as little as 5 minutes, and that facilitates on-time arrival to your destination for whatever event or care appointment you're seeking. Next slide, please. Just a couple more highlights about how this works. So, rides are scheduled on demand, as I mentioned, in up to 30 days in advance. So this enables you to kind of book out if you've got a lot of kind of standing or repeat appointments. It enables you to manage those, but it also enables the ability to address immediate needs in short order, which I think is in just about anywhere where Uber's network is present, which is unique. Riders can confirm before they're ready that they're ready before their driver is sent. So this is another critical factor we found in some of our early days of testing, that particularly when you have a third party orchestrating rides, sometimes there's that disconnect. And I think Jill highlighted this. One of the advantages of having a cell phone, and it doesn't need to be a smartphone, but just one with SMS capabilities, is that you can interact with and indicate when you're ready, so that the driver comes at your schedule. And lastly, as I mentioned, multiple rides can be scheduled at once. Next slide. So the other thing about that organizations, I think find beneficial about working with a platform like Uber Health is the transparency and the reporting capabilities. So just like the Uber app itself, you have access to a live dashboard. So when trips are happening, you can track where the vehicles are from a safety standpoint and from a transparency standpoint, as well as just from a logistics coordination standpoint. You also have access to detailed ride history, so you can investigate if there are any kind of accounting issues that you want to follow up on, or if you just want to track usage and understand how your members and participants are using the platform. And then, of course, we have standardized monthly billing to help smooth that process out as is needed. Next slide, please. The last thing about the platform is that it benefits from access to Uber's global technology platform. So every day we do 100 and we're present in over 600 cities globally. We do several millions of rides daily around the world, in places like Brazil and places like the Middle East and Africa, and all over Europe, as well as the US. And what that does is it forces us to continue to innovate to provide a high-level product in all of these markets. And those innovations, in turn, become available across the board to all of our locations. And so that's a real advantage as we continue to evolve the product over time. Next slide, please. Go ahead and skip 2 more ahead.
And this is, you have 1 minute.
Okay, perfect. Yeah, we'll wrap here. So actually, you can skip one more slide. So just wanted to talk briefly about one more slide. Sorry. Briefly about our commitment to safety. So Uber has, and obviously we recognize we're putting, individuals in cars with one another, on millions of individuals in cars with one another on a day-to-day basis. So, it's critical that we get this right. So some of the platform innovation that I was talking to you about, we've continued to implement, and it's a core part of what Uber Health offers. As an example, last year we published our first in the industry to publish a report on safety. We have phone motion detection to encourage drivers to not engage with their phone while they're driving. This is relevant in light of COVID. We have facial recognition to ensure that the driver is who they say they are before you get in the car, but also we are now requiring that all drivers wear face masks for both their safety and the safety of our passengers, and that is built into our facial recognition software. We also have several other safety features that we've implemented over the years. I won't go into those, and we can go ahead and wrap there because I know we have Michael and others who still need to speak. But, the last thing I'll say is our CEO has made safety in particular a company-wide priority. We're very attuned to the fact that this is a critical aspect of our riders and our drivers' experience, and without that, we ought not be in this business. And so, thank you all for the time. Very happy to answer any questions at the end if there's time left.
Okay, thank you so much. Michael, are you on? Okay, Michael, we're going to go ahead if you can hear us. And so, taking a look at some of the questions that we have. Does Uber Health allow a caregiver to accompany someone at no cost if the person requires this?
Hi, yeah, thanks for the question. So if the trip is ordered for one individual and another individual wants to accompany that individual on the trip, there is no additional cost. So that is absolutely something that's feasible. It would just have to be coordinated. They would have to obviously be present with the individual at the time of pickup.
Okay, you're getting a number of questions here on Nevada. Are the drivers trained to work with individuals with disabilities?
So that's a great question, and actually, I think it was helpful that we had some of the other presenters beforehand as well. So, I think Jill did a nice job of highlighting where Uber Health fits into the ecosystem of transportation options today, and I think the short answer is we have a variety of different what I call product offerings. So if you open your Uber app today, what I mean by product offering is you'll see there's Uber Black, there's Uber X, there's Uber XL. Those are different product offerings that tie you into distinct vehicle types, but also distinct ride experiences. A couple of those that we have in different markets are what we call our Uber Assist product, which is a door-to-door product, as well as our Uber Wave product, which is a wheelchair-assisted vehicle product. Those two products are available in select markets, and for those products where they are available, the drivers do have additional third-party specific training to help individuals, on our assist side door-to-door access. So they're trained to provide individuals with support in egress and ingress of the vehicles. But the vehicle types themselves are also slightly different, slightly higher, more spacious, so that entering and exiting the vehicle is made easier. What I will say is that those trips represent a small proportion of our trips today, and while we continue to develop those areas, we do rely heavily on our other transportation partners who have oftentimes a good understanding of the local context and needs, which are critical aspects of the experience for our members. So we see ourselves as much as a complement to that, as well as trying to directly serve that population.
Okay, thank you. I just heard from Michael Ratcliffe. He says he's unmuted now. Michael, are you on? Nope. No, isn't technology wonderful when it works? Okay. They also want to know what customer service is like at Uber Health. And specifically, are there people answering the phones in a timely manner to mitigate issues that might be happening, in real time during the trip?
Yeah, thanks for the question. So given the way that the Uber Health platform is designed, and that it's a B2B product, so we work through organizations and not directly with consumers, we rely on the organizations who own and have that relationship with their customers to manage the vast majority of customer service incidences in a live fashion. So if you're trying to connect with your driver, or you have questions about a trip that you've scheduled in advance, that would be facilitated through the organization with whom you are booking the trip. So in this case, with Jill's organization, you would use them and leverage them as your primary kind of customer service starting point. And we do that for a number of reasons, but primarily because, again, they understand the context, they know they have the relationship with the membership population, and they also have full control over kind of the platform and scheduling tools. That being said, there are issues that are specific to Uber that may follow subsequent to the trip. For example, if you leave something in the car, or you have an incident, or God forbid there's an accident or something like that, that requires us to follow up with the driver and/or do any other kind of follow-up investigations. That's where we have a support team that's available 24/7 to address those issues, and we would work closely with both the organization with whom we partner, as well as any individuals involved in those instances.
Okay. We have people that are asking for your contact information. Are you fine if I send it out?
Yes, please. Go ahead and please share my email with whomever would like it.
Okay. I'm hearing that people aren't able to download the handout. The handout, it will be available on our website, which is www.sil-oh.org. Here's a question about asking about, and I'm assuming this is for Deborah. Do you only accept self waivers because it can be billed under PDGS? And are you expanding into Summit County?
We only accept self waivers because we are not Medicaid certified for the IL or level 1 waivers. We are not originating trips into Summit County, but some of our drivers would be willing to drive to Summit County. So we talk about it on a case-by-case basis, because we go wherever the drivers are comfortable driving. And while we maintain a core list of drivers, we do get new drivers periodically with different ideas.
Okay, and Deborah, I believe this one is for you too. Are any of the drivers' vehicles wheelchair accessible?
No, they are not at this time.
Okay. Okay, let's see if I have anything else. I'm just going through all the questions and see who's signed up. Okay, let me go back down and just make sure I don't have any new questions. Can Uber Health be used for employment?
I'm assuming the question means in connecting passengers to and from places of employment. And if that's the question, then absolutely, yeah. So there is no limitation, although the name would suggest it's focused on health. You know, we interpret health very broadly. So in the context of social determinants, I think many in the audience will appreciate that, you know, there are many drivers of health, and employment and income is a very important one of that. And so, you know, we very much take a holistic approach to this. Of course, you know, the access to whether it's work, whether it's social engagements in your community, or other destinations, those are all supported. It would be something that you would just coordinate directly through the third-party organization that uses Uber Health.
I was asked to repeat the website information, and that is S as in Sam, IL-OH.org. We have a question regarding social distancing and disinfecting vehicles, and how do you monitor that in light of COVID? And this would be for anybody.
This is Debbie from Fairclay. We are on hiatus now because of COVID, but we are reopening in a couple of weeks, and we have levels of PPE that were suggested by both the CDC and the Department of Developmental Disabilities, which includes temperature, sanitation wipes, masks, and a sneeze guard in the car because people are not driving giant cars. So we are restricting passengers to one at a time. The passenger has to sit in the back, and there's a sneeze guard between the front and the back seat.
Okay. Anybody else want?
This is Nevada. Yeah, so I'll echo that. So we follow. We have an internal epidemiologist with whom we've been working to set our policies around this, again in line with the CDC and other guidelines. So similarly, we provide as I mentioned earlier, we provide and require masks for our driver partners and passengers. And we provide PPE to our drivers to clean and sanitize the car in between trips, and you know, encourage a number of other best practices during the trip, including where possible leaving windows open and so forth. And do provide you know, plastic barrier divisions and sneeze guards where available to help further protect passenger and driver safety.
Okay, and we're going to take the one final question, and that is, are the costs different? Is there cost difference between regular Uber and Uber Health?
Yeah, thanks for the question. No, the costs are exactly the same. It's the same network in almost every market, unless you're using your door-to-door, the Assist or Wave product.
Okay, thank you so much. Okay, so for those who need certificates of attendance or social work CEUs, that's the only CEU that we're able to offer. Social work CEUs, please, you've signed in already using the question box, sign out before you leave. All I need is your name saying, you know, this is so-and-so signing out, and that'll be your in and out. I want to thank the speakers, and I want to thank the audience and the participants for their patience. We've gotten better at doing this, but we've never hit the where our internet was going in and out. So I'm not sure what happened or what's going on, but your patience has been truly appreciated. Again, look for the PDFs of the slides on our website, sil-oh.org. And thank you very much. Oh, social workers, you will be getting a feedback form from us, and it's going to come from Simone Jones. And once you send in that feedback form, your certificates will be sent out. Thank you very much. Take care and have a great day. Bye now. Wow.